The distinguished senator from Louisiana.
Thank you, Mr. President. I first want to commend my colleague on the floor, Senator Cantwell, the senator from Washington State that's worked so hard and so long and in such a professional way. And she's been extremely helpful to me through this process, and I want to acknowledge that and thank her. I also, before I make the statement, Mr. President, want to comment about a few other colleagues that have been extremely helpful and supportive, not just to me, but I think to the entire Senate, beginning with Senator Harry Reid, our leader, who with patience and persistence and care have led to a bill that is before the Senate. The question today is whether we should proceed. I would like to say that there probably, in my view, maybe no other member of the Senate could have accomplished what he has today, and I think many senators share my thoughts and belief. Number two, I want to recognize the extraordinary work of a senator from Oregon, Senator Ron Wyden, who 2 years ago, before the process of election of president really significantly got underway, before it was really ever clear as to who might win, he put down a bill called the Healthy Americans Act, which I was very proud to support and still am so proud of his effort today, that had the support of almost 7 Republicans and 7 Democrats, a truly bipartisan effort that would accomplish, in my view, what many Americans are asking for: a marketplace that's fixed and reformed, more choices, affordable choices for individuals and small businesses and families, and a real effort to curb the rising and alarming cost to the federal taxpayers, given that the percentage now of our GDP spent on health care is almost exceeding 16%, twice as high as any nation in the world. That is alarming, and that bill and that effort went a long way to help frame my thoughts on this debate. I also, and we're going to continue to work together through this process, I also want to thank Senator Blanche Lincoln, who, because of her persistent leadership, has pushed and prodded members of this body to give the time necessary for the review that our constituents, whether they are for or against the directions that we're moving, have the time. I have used that time, I think, very well these last 2.5 days. I have been in meetings with economists, on phones with healthcare experts, talking with people from my state as well as around the nation. And I have used that time well and wisely, and because she pushed for it, many of us received the time we needed. And I know she'll be speaking on the floor later today, giving her final views on where we are. Madam President, I come to the floor today to acknowledge those members, but also to speak on the business before the Senate today, and that is the question of whether or not to proceed to debate on the Patient Protection and Affordability Act, a bill that is the best work of the Senate to date on a subject of significant importance to the people of my state and the country. My vote today to move forward on this important debate should in no way be construed by the supporters of this current framework as an indication of how I might vote as this debate comes to an end. It is a vote to move forward to continue the good and essential and important and imperative work that is underway. After a thorough review of the bill, as I said, over the last 2.5 days, which included many lengthy discussions, I've decided that there are enough significant reforms and safeguards in this bill to move forward, but much more work needs to be done. Over the past many years, and in particular the last 6 months, I have heard from people all across Louisiana that their insurance premium costs are simply too high and continue to rise without warning, threatening the financial stability of their families and their businesses. I have also heard the pleas and cries of many people who need coverage, health coverage, but they can't find it anywhere within reach of their budgets. Through months of public meetings in VFW halls, school gyms, and in hospitals and health clinics, from New Orleans to Shreveport, in large and small communities throughout my state, it is clear to me that doing nothing is not an option, nor is waiting any longer for this debate to begin, to continue, and to come to some final conclusion. Spirited debate and good faith negotiations in this Senate have produced a bill that contains some amazing and cutting-edge reforms that will, I am hopeful, reduce costs for families and small business while reducing the debt burden of the federal government. But these reforms must be implemented properly and carefully, and they must be put in place in a timely fashion. Small business owners across the country have told me time after time, in order to remain viable and create the jobs they want to, and Madam President, may I say, the jobs we need them to create if we're going to work our way out of the recession that we're in, they need affordable health insurance, and they need stable and predictable costs. Yes, they would like their costs to be lowered, and I'm going to stay focused like a laser on doing that. But what they also need is predictability, simplicity. They need to be able to plan, and so they can get to their job, which is creating jobs, and not finding their way through very complicated and limited choices under the current situation. As we all know, the current situation, small business owners are frequently confronted with impossible choices. When an employee or an employee's family member gets seriously ill, they can expect exorbitant cost increases of the meager plans and choices they have, or they can go to that employee and those family members and say, I'm sorry, to save my business and the other 10 employees, we need to let you go. Here's $1,000 or $2,000 or $5,000. You're on your own. Good luck. That is a tragic story, painful and depressing, and it has to stop. So I appreciate the hard work of many, many business owners and organizations that have helped to craft portions of this framework, because they have remained at the negotiating table. They didn't run and hide. They remained at the table. I'm asking them today to stay at this table. Before I discuss the work that needs to be done to improve this bill, I'd like to discuss some of the points in this bill that encourage me to move forward. Small business owners, under the current framework of this bill, would no longer be confronted with these kinds of volatile costs. This bill prevents insurance companies from escalating their rates or dropping their coverage after someone gets sick. That important change goes a long way in stabilizing the amount small businesses will have to pay for their health plans, and it allows business owners to do what they do best: plan smart investments, grow their businesses, and then help us grow our economy. In recent years, economists have found workers' wages have remained largely stagnant. Why? Because employers are paying more and more for health care that we are indirectly subsidizing through the current tax code, leaving less and less money to pay real wages that workers in large and small businesses could actually take home, put in their pockets, and spend in much more productive ways.